The silent threat, the dangers of high eye pressure. High eye pressure, medically termed ocular hypertension, is a condition that often goes unnoticed, yet it poses a significant threat to your vision. While not immediately causing symptoms or vision changes, persistently elevated eye pressure is a primary risk factor for a group of serious eye diseases known as glaucoma, which can lead to irreversible vision loss and even blindness if left untreated. Normally, intraocular pressure, IOP, typically ranges between 10 and 21 millimeters of mercury, mmHg. Readings consistently above this range may indicate ocular hypertension. It's a surprisingly common condition. Ocular hypertension is estimated to affect approximately 3 to 5% of individuals over the age of 40 in the general population. While many with ocular hypertension won't develop glaucoma, the elevated pressure significantly increases their risk compared to those with normal eye pressure. The link to glaucoma, a critical connection. The most concerning complication of high eye pressure is its direct association with glaucoma. Glaucoma is a collection of conditions that progressively damage the optic nerve, the vital cable that transmits visual information from your eye to your brain. This damage typically results in gradual vision loss. Glaucoma often begins by eroding peripheral, side, vision, a change that can be so subtle that individuals may not notice it until substantial and irreparable damage has occurred. As the disease advances, central vision can also be compromised, potentially leading to severe vision impairment or complete blindness. Optic nerve deterioration. Sustained high pressure puts immense strain on the delicate nerve fibers within the optic nerve, leading to their progressive damage and eventual loss. The silent thief of sight, glaucoma has earned this ominous moniker because its early stages are usually devoid of noticeable symptoms. This stealthy progression underscores the critical importance of routine eye examinations for early detection and intervention. Beyond glaucoma, other potential issues. Even in the absence of a formal glaucoma diagnosis, elevated eye pressure can still exert detrimental effects on the optic nerve, increasing the likelihood of future damage. In rare instances, particularly in acute angle closure glaucoma where pressure spikes dramatically, individuals might experience more pronounced symptoms, including severe eye pain, headaches, especially localized around the eyes, blurred or hazy vision, the perception of halos or colored rings around lights, noticeable eye redness, nausea and vomiting, often accompanying intense eye pain. In some cases, extremely high pressure can also lead to corneal swelling or cloudiness, further impairing vision. Understanding the mechanism, why pressure builds. High eye pressure typically arises from an imbalance in the eye's fluid dynamics. Your eye constantly produces a clear fluid called aqueous humor within a structure called the ciliary body. This fluid nourishes the eye and then drains out through a specialized drainage system, called the trabecular meshwork, which is like a tiny sieve. A healthy balance between fluid production and drainage keeps your eye pressure at a healthy level. Think of it like a sink with the faucet running at a normal rate, but the drain is partially clogged, the water level in the sink will rise. Most commonly, high eye pressure results from impaired drainage of aqueous humor, where the fluid is produced at a normal rate but cannot exit the eye efficiently, leading to a buildup of pressure. However, in some cases, an overproduction of aqueous humor can also contribute to elevated eye pressure. While less common than drainage issues, potential causes for overproduction include abnormalities or overactivity in the ciliary body. The ciliary body's cells are responsible for actively secreting aqueous humor. Any dysfunction or heightened activity in these cells could lead to increased production. Inflammation, uveitis. Inflammation within the eye, specifically involving the ciliary body, part of the uvea, can sometimes temporarily increase aqueous humor production by altering the normal fluid balance. Certain tumors or cysts, very rarely, growths within or near the ciliary body could stimulate increased fluid secretion. Medication side effects. While many eye medications aim to reduce aqueous humor production, certain systemic drugs, or even long-term use of corticosteroids, can sometimes inadvertently affect the delicate balance and contribute to elevated pressure, potentially through altered fluid dynamics. Genetic factors. Some individuals may have genetic predispositions that lead to subtle differences in the ciliary body's function or regulation, resulting in a higher baseline production rate of aqueous humor. Circadian rhythm disruptions. Aqueous humor production naturally fluctuates throughout the day, being higher in the morning. Significant disruptions to this natural rhythm could theoretically play a role in sustained higher pressure levels in some individuals. Unknown or idiopathic causes. In many instances, the precise combination of factors leading to an individual's high eye pressure remains complex and not fully understood, with overproduction potentially playing a role alongside drainage issues. What causes impaired drainage? When the trabecular meshwork, the eye's primary drainage system, becomes less efficient or blocked, fluid builds up, causing increased intraocular pressure, IOP. The reasons for this impairment can vary. Primary open-angle glaucoma, POG. This is the most prevalent form of glaucoma where the drainage angle appears open, but the trabecular meshwork itself is subtly compromised. Cellular dysfunction and aging. Over time, the cells within the trabecular meshwork can become less efficient. This might involve a decrease in the number of functioning cells, structural changes, or the accumulation of debris. Extracellular matrix alterations. The complex network of proteins and other components that make up the trabecular meshwork can undergo abnormal changes or accumulate substances, making the tissue stiffer and less permeable to fluid flow, thus increasing resistance. Genetic predisposition. POG often has a hereditary component, suggesting that inherited traits can lead to a less efficient or more vulnerable trabecular meshwork. In certain specific, rare forms of glaucoma with strong family histories, genetic counseling or testing may be considered to assess inherited risks. Angle closure glaucoma. In this type, the drainage angle itself is physically blocked. Pupillary block. The most common mechanism where the iris, the colored part of the eye, bulges forward, pressing against the lens and impeding the normal flow of aqueous humor from the back to the front of the eye. This pushes the peripheral iris forward, physically blocking the trabecular meshwork. Narrow angles. Some individuals have an anatomically narrow space between the iris and the cornea, making them more prone to the iris blocking the drainage pathway. Plateau iris configuration. A less common anatomical variation where the iris's insertion and shape can narrow the angle. Adhesions. Peripheral anterior synechii, PAS. If angle closure is prolonged, the iris can permanently stick to the trabecular meshwork, forming scar tissue that creates irreversible blockages. Secondary glaucomas. These occur when other pre-existing eye conditions, systemic diseases, or even certain medications cause the drainage system to fail. Pigment dispersion syndrome, PDS/pigmentary glaucoma. Pigment flakes from the iris shed and deposit in the trabecular meshwork, clogging it and impeding fluid outflow. Pseudoexfoliation syndrome, PXF/pseudoexfoliation glaucoma. A flaky, abnormal material forms within the eye and accumulates on various structures, including the trabecular meshwork, leading to clogging. Inflammation, uveitis/inflammatory glaucoma. Chronic or severe inflammation inside the eye can directly damage the trabecular meshwork, or inflammatory cells and debris can clog it. Scarring from inflammation can also lead to angle closure. Neovascular glaucoma. Abnormal new blood vessels grow on the iris and into the drainage angle, often secondary to severe conditions like advanced diabetes or retinal vascular occlusions. These fragile vessels can bleed, and their growth, along with associated scar tissue, can physically block or pull the angle closed. Trauma. Traumatic glaucoma. A direct eye injury, blunt force, can directly damage the trabecular meshwork, lead to bleeding that clogs it, or cause angle recession, where the drainage pathways are compromised due to structural damage. Steroid-induced glaucoma, prolonged use of corticosteroids, especially in eye drop form, but also oral steroids, can significantly increase eye pressure in susceptible individuals by altering the trabecular meshwork's function and increasing outflow resistance. Red blood cell glaucoma/ghost cell glaucoma. Bleeding inside the eye can result in red blood cells or their ghost remnants clogging the trabecular meshwork. Tumors. Intraocular tumors can physically block the drainage angle or release substances that impair the meshwork's function. Lens-induced glaucoma. Conditions related to the eye's lens, such as a dislocated lens or a very swollen cataract, can obstruct the aqueous humor's flow or the drainage angle. Congenital glaucoma. In infants and young children, glaucoma can stem from developmental abnormalities in the eye's drainage system present from birth, such as those seen in conditions like Axenfeld-Rieger syndrome or Peters anomaly. The interplay with cataracts, another common eye condition. While high eye pressure and cataracts are two distinct eye conditions, they are both very common, especially as people age, and can sometimes influence each other. What are cataracts? Cataracts involve the clouding of the eye's natural lens, which sits behind the pupil and iris. This clouding leads to blurry, hazy, or yellowish vision. Unlike high eye pressure affecting the optic nerve, cataracts primarily affect the clarity of vision by obstructing light. How cataracts can influence eye pressure. Lens swelling. As a cataract develops, the eye's natural lens can thicken and swell. This physical change can push the iris forward, narrowing the eye's natural drainage angle. If the angle becomes too narrow, it can impede the outflow of fluid, leading to an increase in eye pressure and potentially triggering or worsening angle closure glaucoma. Pseudoexfoliation syndrome. This condition involves the production of flaky, abnormal material within the eye. This material can deposit on the lens, contributing to cataracts, and also clog the trabecular meshwork, leading to high eye pressure and a specific type of glaucoma. Lens-induced glaucoma. In rare instances, a very advanced or dislocated cataract can directly block the eye's fluid drainage pathways, causing a spike in eye pressure. How glaucoma treatment can influence cataracts. Glaucoma itself doesn't directly cause cataracts. However, certain treatments for high eye pressure or glaucoma can accelerate cataract formation. Specific glaucoma eye drops. Some older types of eye drops used for glaucoma, e.g., miotics, might contribute to cataract development with prolonged use. Glaucoma surgeries. Procedures like trabeculectomy or the implantation of glaucoma drainage devices, while vital for preserving the optic nerve, can sometimes lead to cataracts forming more quickly after the surgery. Steroid medications. If corticosteroids, eye drops or oral, are used to manage high eye pressure, e.g., in inflammatory conditions, prolonged use is a known risk factor for both high eye pressure and cataracts. Cataract surgery and eye pressure. Temporary post-surgical spikes. It's common for eye pressure to temporarily increase immediately after cataract surgery, often due to inflammation or retained surgical material, but this is usually managed with medication and resolves quickly. Long-term pressure lowering. Often, cataract surgery can lead to a beneficial reduction in intraocular pressure over the long term, especially in patients who had higher pressures before surgery or those with angle closure glaucoma. Removing the thickened lens creates more space in the eye's front chamber, which can widen the drainage angle and improve fluid outflow. Combined procedures. For patients who have both a visually significant cataract and glaucoma requiring intervention, ophthalmologists can sometimes perform a combined cataract removal and glaucoma surgery, such as a trabeculectomy or a minimally invasive glaucoma surgery (MIGS) procedure, in one operation. This addresses both conditions simultaneously. In essence, while distinct, these conditions frequently coexist due to shared risk factors like aging, and their treatments can sometimes affect each other. This underscores the importance of a comprehensive eye exam that evaluates all aspects of your eye health. Other specific causes of high eye pressure. Beyond the primary categories of impaired drainage and overproduction, certain specific medications and less common systemic conditions can also directly contribute to elevated intraocular pressure. Medication-induced eye pressure, beyond steroids. Anticholinergics, used in various medications, e.g., some antidepressants, antihistamines, decongestants, drugs for overactive bladder, antiparkinsonian drugs. These can dilate the pupil, which can precipitate angle closure glaucoma in individuals with narrow or occludable angles. Sulfa-containing drugs, e.g., topiramate medications like topiramate, used for migraines and seizures, or certain diuretics containing sulfa can cause an idiosyncratic reaction involving ciliary body swelling. This swelling pushes the lens and iris forward, leading to acute angle closure glaucoma, even in eyes without pre-existing narrow angles. Certain antidepressants, some selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, TCAs, can lead to pupil dilation, increasing the risk of angle closure in predisposed individuals. Decongestants, oral decongestants, particularly those with adrenergic or anticholinergic properties, can also cause pupil dilation and potentially trigger angle closure. Less common systemic conditions. Carotid cavernous fistula, an abnormal connection between the carotid artery and the cavernous sinus, a network of veins behind the eye. This leads to increased venous pressure in the eye, which directly elevates IOP. Sturge-Weber syndrome, a rare congenital neurological and skin disorder often characterized by a facial, port wine stain birthmark. Individuals with this syndrome frequently have associated vascular abnormalities in the eye, e.g., episcleral hemangioma, that raise episcleral venous pressure and result in high IOP and glaucoma. Superior vena cava syndrome, obstruction of the superior vena cava, a large vein that carries deoxygenated blood from the upper body to the heart. This can cause increased venous pressure in the head and neck, potentially leading to elevated intraocular pressure. Thyroid eye disease, Graves' ophthalmopathy in severe cases, the inflammation and swelling of the eye muscles and orbital tissues can compress the veins that drain the eye, leading to elevated episcleral venous pressure and subsequent high IOP. Who is at risk for high eye pressure? Ocular hypertension. While anyone can develop high eye pressure, certain factors can increase your likelihood. Age. The risk of ocular hypertension generally increases with age, particularly after 40. Family history. If you have a close relative, parent, sibling, with ocular hypertension or glaucoma, your risk is higher due to genetic predispositions. Ethnicity. Individuals of African, Hispanic, or Asian descent may have a higher risk for certain types of glaucoma related to high eye pressure. Medical conditions. Certain systemic health conditions, such as diabetes, high blood pressure, heart disease, or sickle cell anemia, can increase the risk. Eye anatomy. Specific anatomical features, such as thin corneas, the clear front part of the eye, or a naturally narrow drainage angle, can predispose individuals to higher eye pressure or certain types of glaucoma. Steroid use. Prolonged use of corticosteroid medications, particularly in eye drop form, but also oral steroids, can significantly raise eye pressure in susceptible individuals. Eye injury or surgery. Previous eye trauma or certain eye surgeries can sometimes affect the eye's drainage system. High myopia, nearsightedness. Severe nearsightedness can be a risk factor for certain types of glaucoma. Managing high eye pressure, treatment and prevention strategies. It's important to understand that for most individuals, ocular hypertension, high eye pressure, and primary forms of glaucoma, like POG, don't have a cure in the sense of making them permanently disappear without intervention. Instead, the primary goal of treatment is to manage the pressure effectively, thereby preventing it from causing optic nerve damage and progressing to glaucoma, or slowing the progression of existing glaucoma. However, for some secondary causes of high eye pressure, e.g., due to specific medications, inflammation, or certain treatable systemic conditions. Addressing the underlying cause can, in some cases, lead to a resolution or cure of the elevated pressure. Here's how eye care professionals approach managing high eye pressure and strategies that can help. One, preventing the onset of high eye pressure, where possible. While many risk factors for high eye pressure are unmodifiable, like age, genetics, or ethnicity, certain strategies can reduce the likelihood of developing it, particularly in cases linked to lifestyle or controllable systemic factors. Proactive systemic health management. Controlled diabetes and high blood pressure. Meticulously managing these conditions is crucial, as uncontrolled diabetes can lead to severe eye complications, and severe hypertension can impact ocular blood flow. Regular checkups with your primary care physician are vital. Address thyroid disorders. If diagnosed with thyroid eye disease, working with an endocrinologist and ophthalmologist to manage the underlying condition can prevent or mitigate related eye pressure elevations. Manage sleep apnea. Untreated sleep apnea has been linked to an increased risk of glaucoma. Seeking diagnosis and treatment can be beneficial for overall and eye health. Cautious medication use. Inform your doctor. Always inform your eye care professional about all medications, prescription, over-the-counter, supplements you are taking, especially if starting new ones. This allows them to assess potential ocular side effects. Discuss alternatives. If you are on a medication known to potentially raise eye pressure, e.g., corticosteroids, topiramate, some anticholinergics, discuss the risks and benefits with your prescribing doctor and eye doctor. Your eye doctor may recommend closer monitoring or alternative treatments if appropriate. Preventing eye trauma. Wearing protective eyewear during sports, DIY projects, or in hazardous work environments can prevent direct eye injuries that can lead to traumatic glaucoma. Healthy lifestyle habits. While not direct preventatives for primary ocular hypertension, these habits support overall health and can influence risk factors. Healthy diet. A balanced diet rich in fruits, vegetables, and omega-3 fatty acids contributes to overall well-being and cellular health, which can indirectly support ocular health. Regular exercise. Moderate aerobic exercise can improve general health and blood flow, which may play a role in maintaining healthy eye pressure. Maintain a healthy weight. Obesity is linked to various systemic conditions that can impact eye health. Avoid smoking. Smoking severely impairs blood vessel health throughout the body, including the eyes, and is a significant risk factor for many chronic diseases. Two, slowing progression and managing existing high eye pressure/glaucoma. Once high eye pressure is detected, the primary focus shifts to preventing or slowing optic nerve damage. For those already diagnosed with glaucoma, treatments aim to preserve remaining vision. Close monitoring, observation. If your eye pressure is only slightly elevated and your eye doctor determines you have a low risk of developing glaucoma, they may opt for close monitoring. This involves regular, frequent eye exams to measure eye pressure, meticulously examine the optic nerve for any subtle changes, and perform visual field tests. This approach is chosen when the benefits of immediate treatment don't outweigh the potential side effects of medication, with careful consideration of individual risk factors like age, family history, and corneal thickness. Medications. Eye drops. The most common and often first-line treatment for high eye pressure involves prescription eye drops. These drops work by either decreasing fluid production. They reduce the amount of aqueous humor your eye produces. Increasing fluid drainage. They help the aqueous humor drain more efficiently from your eye. Common types of eye drops include prostaglandins, beta blockers, alpha-adrenergic agonists, carbonic anhydrase inhibitors, CAIs, and newer options like Rho kinase inhibitors. Your doctor will typically start with one type and may add others if needed to achieve your target pressure. Consistency in using these drops as prescribed is crucial for their effectiveness and for preventing further optic nerve damage. Why aren't oral medications primary for eye pressure? It's a common question why there aren't oral medications for eye pressure similar to the pills used for systemic high blood pressure. The key difference lies in the target and the side effect profile. Targeted delivery. Eye drops deliver medication directly to the eye's surface, allowing for high concentrations at the site of action, ciliary body for fluid production, trabecular meshwork for drainage, with minimal systemic absorption. This means fewer side effects throughout the rest of the body. Systemic side effects of oral drugs. While some oral medications, notably oral carbonic anhydrase inhibitors, like acetazolamide, do lower eye pressure, they do so by acting throughout the entire body. This leads to a higher burden of systemic side effects, such as tingling in hands/feet, fatigue, loss of appetite, kidney stones, and electrolyte imbalances. These side effects are often too significant for long-term, routine use in all patients. Limited role for oral medications. Oral medications for eye pressure are typically reserved for acute situations, when eye pressure needs to be lowered very rapidly, e.g., during an acute angle closure glaucoma attack. Short-term bridge therapy, to temporarily control pressure while awaiting laser or surgical intervention. Refractory cases, in severe or complex glaucoma where eye drops and surgical interventions have not achieved adequate pressure control. Disease mechanism differences. Systemic hypertension involves a complex network of blood vessels and organs throughout the body, making systemic medication appropriate. Ocular hypertension primarily involves fluid dynamics within the small, enclosed space of the eye, which can often be managed effectively and safely with localized topical treatments. Laser procedures. If eye drops aren't sufficient, cause significant side effects, or aren't tolerated, your doctor might recommend laser surgery. These procedures are usually performed in the eye doctor's office. Laser trabeculoplasty, e.g., selective laser trabeculoplasty, SLT. This procedure uses a laser to improve the natural drainage of fluid from the eye. It can often reduce the need for daily eye drops for a period, thereby helping to maintain lower pressure and slow disease progression. Laser iridotomy, primarily used for conditions like acute angle closure glaucoma. This laser creates a tiny opening in the iris to allow fluid to flow more freely. This can prevent or reverse angle closure, which might otherwise lead to rapid and severe vision loss. Traditional surgery. In more severe cases, or when other treatments haven't been effective, your doctor may suggest more traditional surgical procedures. Trabeculectomy. This is a filtering surgery where the surgeon creates a new drainage pathway in the white part of the eye, sclera, to allow fluid to drain to a small, hidden bubble under the conjunctiva. This procedure aims to significantly lower intraocular pressure when other methods fail, thereby preserving remaining vision. Drainage tubes/implants. A small tube or device is surgically implanted in the eye to help drain excess fluid to an external reservoir. These are used to provide consistent long-term pressure control, especially in complex cases. Minimally invasive glaucoma surgery, MIGS. This is a range of newer, less invasive surgical techniques, often performed in conjunction with cataract surgery, designed to improve fluid drainage through tiny devices or procedures. MIGS procedures offer a less invasive option to lower pressure, often with faster recovery times. Lifestyle factors, supportive measures for progression control. While lifestyle changes alone cannot cure high eye pressure or glaucoma, they are important supportive measures alongside medical treatments for maintaining overall health and potentially influencing disease progression. Healthy diet. A balanced diet rich in fruits, vegetables, and omega-3 fatty acids contributes to overall eye well-being and systemic health, which can indirectly support ocular health. Antioxidants may help protect nerve cells. Regular exercise. Moderate aerobic exercise, like brisk walking or cycling, can improve general health and may help regulate eye pressure by improving blood flow. However, discuss any intense exercises, especially those involving head-down positions, like certain yoga inversions, or heavy lifting, with your doctor, as they might temporarily increase eye pressure in some individuals. Manage underlying health conditions. Effectively controlling conditions like high blood pressure, diabetes, and sleep apnea is crucial, as they can have a direct or indirect impact on eye health and glaucoma risk. Avoid smoking. Smoking is detrimental to your entire body, including your eyes. It negatively impacts blood vessel health and can worsen optic nerve damage. Limit caffeine intake. While modest caffeine consumption is generally fine, very high doses may cause a temporary, small increase in eye pressure. Discuss with your doctor if you have concerns. Stress reduction. Some research suggests a link between chronic stress and eye pressure and blood flow. Incorporating stress reduction techniques, e.g., meditation, mindfulness, deep breathing, into your routine may be beneficial. The imperative of early detection. Why waiting is dangerous. Given the often asymptomatic nature of high eye pressure in its initial stages, meaning it typically causes no noticeable symptoms or vision changes at first, regular, comprehensive eye exams are absolutely crucial. This poses a significant challenge because, naturally, most people only seek medical attention when they feel something is wrong. However, when it comes to high eye pressure and glaucoma, waiting for symptoms can have devastating, permanent consequences. Here's why proactive detection is so imperative. Irreversible damage. That a silent thief strikes unnoticed. The most critical reason is that damage to the optic nerve from high eye pressure is permanent and cannot be reversed. Glaucoma has earned the ominous moniker, the silent thief of sight, precisely because it progresses without pain or immediate noticeable vision loss. It typically begins by affecting peripheral, side, vision. This change is often so subtle that individuals don't notice it in their daily lives until a significant amount of vision has already been irrevocably lost. By the time central vision is impacted, or symptoms like blurred vision or halos become apparent, the disease is often advanced and considerable damage has already occurred. Treatment goals: preservation, not restoration. Current treatments for high eye pressure and glaucoma are highly effective at lowering pressure and slowing or halting the progression of optic nerve damage. However, their primary goal is to preserve existing vision, not to bring back vision that has already been lost. This underscores the urgency of identifying the condition before substantial harm occurs. What's lost cannot be regained. Better prognosis with early intervention. Detecting high eye pressure or early glaucoma through routine screenings allows for timely intervention, whether through consistent monitoring, daily eye drops, or other procedures. Starting treatment early, before significant optic nerve damage accumulates, significantly improves the prognosis and dramatically increases the likelihood of maintaining good vision throughout one's life. It's about preserving your future sight. How high eye pressure is detected and monitored. The most comprehensive and reliable method for detecting and diagnosing high eye pressure and glaucoma is through a regular, comprehensive eye exam performed by an optometrist or ophthalmologist. For adults over 40, it's generally recommended to have a comprehensive eye exam every 1 to 2 years, or more frequently if you have known risk factors for high eye pressure or glaucoma. This exam goes beyond a simple vision check and includes tonometry, measures your eye pressure. This might involve a gentle air puff or a soft touch on your eye after numbing drops. Optic nerve examination. Your doctor will look closely at your optic nerve, after dilating your pupils with drops, for any signs of damage. Visual field testing. This test checks your peripheral, side, vision to find any blind spots you might not have noticed. Corneal thickness measurement, pachymetry, a quick, painless test to measure the thickness of the front of your eye, which helps your doctor interpret pressure readings more accurately. Gonioscopy. Your doctor uses a special lens to directly look at your eye's natural drainage angle. Advanced imaging, e.g., OCT, optical coherence tomography. This non-invasive scan provides highly detailed pictures of your optic nerve and the nerve fibers around it, helping detect subtle changes over time. While these comprehensive in-office examinations are essential for diagnosis and ongoing management, some newer technologies allow for home monitoring of eye pressure in specific situations. Home tonometers, self-measurement devices. Devices like the iCare home tonometer allow individuals to measure their eye pressure themselves, often multiple times a day. Purpose: these tools are primarily used for monitoring patients who have already been diagnosed with high eye pressure or glaucoma, allowing their doctor to track pressure fluctuations between appointments. Limitations: they measure pressure only and do not assess the optic nerve or visual field. They are not a substitute for regular, comprehensive eye exams for initial diagnosis or complete disease evaluation, and their readings must always be interpreted by an eye care professional. By understanding the potential dangers of high eye pressure, taking proactive steps to manage systemic health and medication use, and prioritizing regular eye checkups, especially if you have risk factors, even without symptoms, you can take significant steps to safeguard your precious gift of sight. Don't wait for symptoms, schedule your eye exam today. Conclusion: understanding and managing high eye pressure. High eye pressure, or ocular hypertension, is a complex condition that often develops without symptoms, yet poses a serious risk to vision, particularly as a leading cause of glaucoma. This article has explored how elevated intraocular pressure arises, whether due to impaired drainage, overproduction of aqueous humor, or secondary causes such as medications or systemic diseases. We highlighted that normal eye pressure typically falls between 10 and 21 millimeters of mercury. We've examined how high pressure can damage the optic nerve, even before glaucoma is diagnosed, and reviewed the wide range of potential contributors, from anatomical variations and age-related changes to rare syndromes and drug reactions. We also discussed the intricate relationship between high eye pressure and cataracts, noting how they can influence each other, especially as both are common age-related conditions. Risk factors such as age, genetics, ethnicity, and other health conditions were also discussed in detail. Fortunately, a variety of effective treatments exist, including medicated eye drops, laser therapies, and surgical options, all aimed at reducing pressure and preventing optic nerve damage. Lifestyle adjustments and regular monitoring also play an important role in comprehensive eye care. Ultimately, the best defense against the silent threat of high eye pressure is education, regular comprehensive eye examinations, especially for those over 40, or more frequently with risk factors, and informed, proactive management. With the right care, long-term vision preservation is achievable for most people.